Hello, parents. Today, I want to talk about the topic of refusing the breast, especially when it is caused by a baby preferring the flow of a bottle. If they got used to bottles, or if you've recently returned to work and suddenly baby won't take your breast anymore. I get that a lot, and it just breaks my heart to hear when baby is refusing the breast and how frustrated and stressed the parent usually is. My answer to that is almost always just return to the basics. The basics being when baby was first born, all we tell you is do skin to skin, try to prevent the use of artificial nipples and all of that stuff, and just like connect with your baby and bond and do all of those beautiful things. So if you have recently returned to work and your baby is refusing to breastfeed, or if you have introduced the bottle and suddenly your baby is refusing to breastfeed, first and foremost, I would recommend to just return to your roots. Take a couple days to just work on that. Make your priority nursing your baby and spending time with them, and only that. I always recommend to just stay in bed, put on your favorite shows on TV and just binge watch and stay in bed with your baby. If your baby is young, like a couple months old, do skin to skin all day, every day. Skin to skin is when you are topless and the baby is only in a diaper, and you just spend time with the baby on your chest. It doesn't need to be only for feeding times or not related to that. Just spending time with the baby close to that area and their sense of smell activated will help them kind of return to the breast. If your baby is a little older, a skin to skin will look a little different. They will not be nestled between your breasts and just laying there. They will probably be crawling around the bed or just moving around. And even in that case, being present like that and making the breasts available for them will help them kind of come back to that to their roots. So in either case, skin to skin is helpful up until whatever age your baby decides that they don't want it anymore. Another thing that is super, super helpful is if you have a bathtub, to just fill it with warm water and spend time in it with your baby. Get in the tub. The warm water kind of revives the baby's instincts to nurse. Most babies who are refusing the bottle will actually nurse in the tub, and that really helps just kind of do that reconnection. Babies love water, and just being in the amniotic fluids, it reminds them of that, and so it might just help them nurse right then and there. If the baby doesn't nurse in the tub, you get up, maybe like 15-20 minutes, however long you both are happy. You dry off really quick and then get in bed and continue to do skin to skin. And just try to kind of remind that baby of their roots. Another thing that you could do is wear the baby clothes, either wearing a deep cut shirt or just topless, and keep the baby on in a baby wearing whatever wrap or carrier that you have. If you are going to return to work after that, or if baby has to have bottles, it is so important to offer the bottle in the paced bottle feeding method. Check my other video for the method, because so that they can learn to continue to use the same, or that they're getting the milk in the same flow rather than that fast, easy flow of the bottle. During that process, I would also recommend to eliminate the use of pacifiers if you're using them. At least minimize it to bare minimum, only if baby is fussing in the car, or if you need to leave the baby to go to the bathroom for a little bit and they need to suck, then you give the pacifier at that time. But the excessive use of pacifiers will also risk the baby to kind of refuse sucking at the breast. Let me know if my video is helpful, and any questions, just post them here and I'll try to answer as much as I can.